encouraging them to think about cupping and what problems does it actually solve for the clients, and
Right.
featuring that in that storytelling proposition in their social media or how they're marketing themselves.
Yeah, absolutely. Like it's really quite interesting. And I built my practice a very similar way. Funny story, when I first started coming to the US a lot, people would always ask me, well, what kind of massage do you do? As a Canadian, that's a really weird question because we learn all of it within our massage program. So it's massage and it's what does it matter? My interest is in the same as yours is what are you suffering? What is your problem that you've come to see me to fix? And then I'm going to, as the professional, choose the correct tool in order to get you there with efficiency, with some speed, alacrity, if you like, because sometimes I use big words and because they're fun. But how do I effectively or most effectively get you from where you are when you walked in the door to where you want to be? And that's my job as a professional. So I do massage, period. The tools that I use, which I understand from early, because I've been practicing for 25 years. When I started going to the States, everyone tried to differentiate themselves. Well, I'm a medical massage therapist. I'm a whatever, myofascial. I'm a Barnes student. I'm a whoever, Upledger person. It meant to be a marketing technique, but it's become pretty meaningless with the amount of massage therapists around. And unfortunately, the base schooling doesn't seem to provide massage therapists with enough background or logical, thoughtful approach to TCM or to massage therapy to actually kind of connect. Well, you could use all of these tools, but it's the outcome and the communication with the patient that's really the important part. The If you want the assessment, the testing, it's the assessment and testing doesn't really matter
Yeah.
ultimately, because it's only based on what kind of treatment you're going to apply. I mean, I test my patients, I assess my patients in a very specific way because of the way I treat.
Yeah.
When I send someone to a different therapist who does different things than me, I am I don't tell them my assessment because it doesn't make any sense. Like that's not their wheelhouse. Like if I'm going to send my patient to a chiropractor for treatment, it doesn't matter what muscles are tight or what joints I think are the problem. It's how they're going to do their assessment that matters. So I find it really interesting. We're not thoughtful enough about our whys.
So just for people who are tuning in, therapists may have a little bit more of an idea about this, but the province that you're in Canada, how many
Yes.
hours is training?
Base hours is 2,200 hours.
2,200. I'm in
Yeah.
Texas, it's 500.
Right.
And I wanted to make that clear for somebody from the public watching this. Like there's, disparate views. And I mean, I went through a 500-hour, or it was actually 637, but a 500-hour program. I'm the
Yeah.
product of that. And I'm talking to educators whose basics was 2,200.
Yeah.
The basics, just to get
And you
started.
can go up from there.
Yeah.
So yeah, it's interesting. And you go to Europe and there's a different set of standards, and you go to Australia, New Zealand, and there's a different set of standards. And yet we all do kind of the same thing. I mean, ultimately it comes down to how many ways of it are there to apply force onto the human body. There's like 7. And then when you combine them, it gets a little exciting. But really, massage is massage. But it's the ability of the therapist and for a patient out there, it's the ability of your therapist to truly kind of understand what they're doing with their body, with your body, or with their application, and think through the problem to get you to where you want to be, whether that's stress relief, range of motion restrictions, relief, pain relief, whatever relief you're looking for. So,
Yeah, here in the States, I would occasionally pose questions in class because selling what I'm teaching, if it's in fact mat based, is a little different. Even if you said, okay, let's table work, but you keep their clothes on,
Yeah.
they're like, man, this is, you could see it in their face. This is different. Like, how do I, package this or, sell this? And I would say, listen, instead of selling massage, can you legally, I would just ask this question, can you legally call yourself a pain relief and mobility specialist?
Mhm.
Like, they're like, is that legal? I'm like, well, there's no laws against it. You're still working within and under your massage license and within your scope of practice as a massage therapist in your jurisdiction,
Yeah.
but you're changing the story. If you're at a party and you say, I'm a massage therapist, that means something. But if you say, I'm a pain relief and mobility specialist, they're more likely to go, whoa, like what is, you're like,
What's
oh,
that?
I specialize in like soft tissue treatments for chronic pain. Ooh, that storytelling process also has a distinction, because I wonder, for instance, if you have a 2,200-hour program, how much did they go into business and marketing? A 500-hour program is just not enough for them to cover the minutia. So, I've got my certificate here somewhere. I got a B in anatomy, by the way. But my schooling was in 2002.
Yeah.
This hadn't really developed at that point. YouTube
No.
wasn't in existence. So the tech marketplace and how we tell stories has changed very, very rapidly.
Oh, for sure. I mean, just look at what YouTube, what Instagram and Facebook have done to practices. When I went to school, it was really important to have a yellow page ad. I haven't had a yellow pages ad for 15 years. Like, it's not important anymore because it's only a very small demographic that use paper directories. Right now, if that's where you live, if that's the group you want to touch, you better have a good yellow pages ad, right? But like, how you reach out to people is super important. In our 2,200-hour program, like, I would completely disregard all of the stuff that I learned at this point because the laws have changed. So there's no the jurisprudence is wrong at this point. The bookkeeping is about the same, but honestly, our bookkeeping class was like, hire a bookkeeper or an accountant, and that's it. Our marketing was get a yellow pages and have business cards and newsletters that we used to mail out, and that's costs a fortune, and things like that. What else was there? There was no thought of how to hire and fire and human resources stuff. There was no real discussion on boundaries at that point because those weren't a thing. They weren't in the late 90s. Like, we never talked about them.
Yeah.
We never really talked about ethics. We never talked about racism. We never talked about sexism. We never talked about all of the isms, which I think should be important parts of our programs at this point, because really teaching a person to be a good massage therapist, part of that, I think, is helping them to be better people. And communication is a huge thing, I think, in massage therapy that is a big black hole in most schooling.
I mean, one of the most, to me, what feels sometimes like the most controversial thing is teaching the students to communicate with the client verbally in session.
Yeah.
And they're like, no, but I'm like, no. I'm not teaching you to be a service provider. I'm teaching you to be a problem solver. If they're in chronic pain, you have to communicate with them more about pressure. You have to communicate with them about sensitivity levels. You have to find out, like, if I move my arm, one way or the other, which is preferred. That's just that. It's a very subtle thing, but it completely changes, I think, clinical outcomes in their practice. And I also found that what it did for me personally is my clients had a closer connection with me, not because of techniques applied, but because it expressed something about my concern about their pain relief.
Not only concern, but your understanding.
Yeah.
Right? And that ability to market empathy it's a story, right? I don't mean story in this particular case. We've said story a lot, and I don't mean necessarily a made up fictional account of something, but it's the way you communicate it, right? And that's the story we're talking about. That ability, how do you translate that into a YouTube video? How do you translate that into patient interaction? One of my favorite tools that a patient brought to me from another therapist was, you know, that little chart of the humans that you have on your intake chart where you say draw on there where your pain is. One of my colleagues was using a version of that and said, I want you to mark on this picture, point on the doll where you don't like to be touched. What a great tool, right? In terms of communicating empathy, she had treated a lot of victims or survivors of rape, abuse, things like that. So it made sense to her that they would shut down if she asked them, but it's really easy to dissociate and just put it on a piece of paper. And then they just mark on there places where she wasn't supposed to touch them. And then she never did. And her practice exploded.
Yeah.
Right? One little thing. One thing. That's it. So I think that's a really good way of letting other people even tell their story within your treatment. And if you can connect with your patient, whether you're applying cupping, mat work, table work, whatever, it doesn't matter. It's how you and your client connect to tell your stories so that they interact. And that therapeutic interaction, that therapeutic relationship is based on the way you can communicate it. So bringing that back around to cupping, making sure that you're talking about cupping in a way that they already understand, in words that are commonly used, in a physiology that they're commonly used, makes way more sense than telling them that they have a chi dysfunction or blood stasis or stuff like that. Because that really, then you have to spend an hour telling them another story, which they probably won't still understand.